Well, it is no secret we all want to look and feel our best at all times, and one of the ways to do that is through facial rejuvenation and some preventative measures. So let's talk about our faces. What is the first thing we all need to make sure that we're doing right now?
Well, facial rejuvenation really starts with good skin care. And so, younger people, we recommend sunscreen and good moisturizers and so on, and that's really the beginning of rejuvenation, or preserving, really. And then we move into more things like fillers and Botox, sort of what we call non-invasive. That can include lasers, ultrasound, and all kinds of different fillers like I talked about. And but then there's a point where it doesn't work anymore. And so then it gets referred to me for surgery.
All right, so let's talk about some of the surgical options, because I think a lot of us are fairly familiar with the idea of fillers or preventative measures like Botox. So when it comes time to see you, one of the senior surgeons, what do we need to keep in mind? What should we be expecting?
My take on this is really about what the patient wants. What is their main concern? Occasionally somebody will come in and say, tell me what I need. I don't like that.
Yeah.
Tell me what you need and tell me what your concerns are. And, the face ages at a predictable, in predictable ways. Usually we lose some fat, we get some jowls, the nasolabial folds get deeper, and so on and so forth. And then also the neck, which is probably 95% of what people are unhappy with.
And I noticed when I was looking at your website, it doesn't necessarily have to be one or the other. You can do some combinations of doing some fillers, maybe partial surgery. So what would be some things to keep in mind, as a client or a patient of yours, different recovery times? What do we need to really think about when we're considering surgeries?
Well, I think that recovery time is always important, because we all have limited time and we all have busy lives. And different procedures have different recovery times. If you were to talk about a standard facelift and maybe doing the eyelids and a little filler, I do a lot of fillers with facelifts, and we use mainly fat now because it's your own fat, and what happens as we age is that the face loses fat, and so we replenish that. And I would say that, if you're not doing anything unusual, then recovery time is about 2 weeks.
Are there any other little pieces of advice that you could give us so that we can be a good patient? So when we come into you, we know what we're doing?
Well, just be open, and be open to ideas, because, we have a lot of little tricks that we can do. And I think that just be open. And, when I talk to a patient about facial rejuvenation, we give them options. I'll say, if I had carte blanche, this is what I would do for you. I would do your eyelids, I would do this, I would put a little fat in here, we'd tighten up the neck, and so on and so forth. And then it's up to you, to decide what you want to do.
All right, well, for those at home who think I need to book a consultation, I want to get in and see you, what's the next step?
So you just call La Jolla Cosmetic Surgery, and all our consultations are free. And you just come in and see us, and first you'll see a coordinator, and then you'll see a nurse, and then you'll see me, and then we'll get it all set up for you.
All right, wonderful. Well, we appreciate your time and that advice. We're all going to be better patients.
Okay, I'll be a good doctor too.
Okay.